Hey, today we're going to discuss some maintenance protocols for the chair. The chair we're going to use for an example today, a very basic hydraulic chair. Very similar to most chairs you're going to see these days, a recent manufacturer within the last 15-20 years. We're using the Shine Crusader chair, which was manufactured by Pelton & Crane for Shine. You're going to see a lot of them out there. Virtually it's identical to the Pelton SP 1500 series. And most hydraulic chairs, Maris, DCI, will all follow the same guidelines. Let's remember that we're only discussing the chair. Again, nomenclature is everything. The name you call something is everything. When we say the chair, we mean the chair only where the patient sits. We don't mean the stool. We don't mean the light. We don't mean the cuspidor. We don't mean the delivery system, nor the mount. We mean the chair only, so that's what we're going to be concentrating on. Now, unlike most aspects of life today, we're going to be starting at the top and working to the bottom of the chair. Very methodical, very, very, very methodical, okay? Let me stress to you that this can lead into more sales again, as I've stressed on other maintenance videos, especially upholstery, which can bring a chunk of change, guys. So we're going to start first visibly looking at the upholstery. We're going to bring our work to us instead of us going to our work. We're going to raise the chair. Do it the Thinking Tax way. Now when we raise the chair, we always look around and be extremely aware of our environments. X-ray arms hanging down, light arms, anything that when we raise the chair up, it could scrape the wall, anything. So before you raise, take a minute and look, okay? We're going to visibly inspect the upholstery. Cuts, tears, ink marks. I don't see any. We have a little bit of delamination on the headrest. Put that in your notes to discuss with the doctor. Maybe an upholstery sale for you again. Let's check out our arms. The pertinent arm is going to be the patient arm, the egress and digress arm. We're going to check it for stability, ease of operation. Does it stow back for the entry and exit position for heavier patients or for more elderly patients? The better these chair arms work, the more stable of a surface the doctor has to work on the patient. And the quicker it is for the patient to enter and exit the chair, and he gets to see more patients, and it makes it flow a lot better and a lot quicker. Okay? Let's take a look at the headrest. This headrest is a double articulating headrest. Pull the headrest up, make sure it retains height without falling down, and it does. Wiggle the chair, simulate a patient in it. Let's check our articulation properties of the headrest. We'll release our thumb screw, flex in different directions to see freedom of movement. Lock it down in a position and make sure that it's stable in that position. We have a little bit of movement. We're going to put that down for the doctor in our list to discuss with the doctor. Remember, we're not doing repairs, we're doing maintenance. And we're doing maintenance with an eye to write up a service call on this, okay? Or for an upholstery sale. Everything looks cool up here. We're going to check our lounge cover or our seat rest for stability. Very stable. Very stable. We're going to check our clear plastic scuff cover or foot guard for integrity, waves, scratches, scuffs. Even if you don't make an upholstery sale, this is an easy sale. These are available from RPI, Pelton, DCI. Most of our vendors will sell a clear scuff guard. Going to move around to the rear of the chair, and we're going to check our swivel for ease of operation. Where my finger is, this is the swivel. We're going to unlock the swivel. We're going to check our swivel for the chair. Now before you go turn it on the chair, guys, again, be aware of your environment. Check your walls. Make sure you're not going to scuff your walls or tear up your drywall. Bang the delivery system that's attached to the chair into the wall. Knock a tray off the wall. You want to be quiet and you want to be professional. We've determined we got freedom of movement. Now we're going to lock our swivel back down securely. We're going to go to the toe of the chair. This is the way I do it. I suggest you do it too. Actually lean into the chair and see if the chair will swivel. And it's not. We passed the swivel test. The swivel's wonderful. If the swivel doesn't grab, or if the swivel wants to rotate after tightening it down, we will cover that in our technical video. Next thing we're going to check, working our way down on the chair, guys, is our safety switch function. While we're lowering the chair, we're going to hit the safety panel. We're going to check it for smoothness, ease of operation. Just wrote up a service call. This is exactly what we want to happen during our maintenance. We will replace this and move on. We've confirmed that our safety switches work. After we confirm that they work, raise and lower the chair one more time, just to make sure that the panel didn't hang up on the switches. Okay? Very good. Now, while we've got the chair up, before we get on the floor, where we're going to stay for the remainder of the video after we get down there, is let's examine carefully the platform of the chair. The floor plate of the platform. While we're under here, you're going to see various crunchies. Kind of clean it off for the guy. You're only as good as you leave your work area. But what I want you to be concerned with and look is for oil, drops of hydraulic oil. That will create an unsafe situation, an unsanitary situation, and also is an indication of a leak in the hydraulic system, be it cylinders or high pressure hoses, all tying into a service call. And I see no oil. Okay, time to get on the floor. You want to be highly organized before you do this. Stay tightly wrapped, tightly wound, paper towels, hydraulic oil if necessary. Hydraulic oil available from most any manufacturer through parts at dentalfix.com. Let's inspect the foot control now. Guys, it's very important when you communicate with me or Paul or text service from the factory over the phone that you say foot control, chair foot control. We have two foot controls. We have a unit foot control, a delivery system foot control, and we have a chair foot control. Please clarify, make it as easy as possible to disseminate and receive your information and your tech help on this, guys. Okay. First, we're going to inspect the cord, especially where the cord terminates in both edges at the chair and at the foot control for fraying, dents, dirt. Usually this cord will be dirty. It can be cleaned with rubbing alcohol and a paper towel, wipe down, or either you can replace the cord. Parts are available. We can get the parts from Pelton & Crane. We can get the parts from Maris. We have any opportunity to get these parts. We're going to look for dents, dings, scuff marks. Remember, guys, this stays on the floor all the time. The doctor and the girls may be stepping on it and rolling over it with a stool. There's only so much it's going to take. Easy replaced item, easy sell. At night, the cleaning people usually handle the foot control roughly. They'll take it and sling it up on the chair like that so they can mop freely and clean freely around the chair base. That puts wear on that cord every time. You're going to find most of your problems that we're going to cover in the technical video is due to the chair foot control or a short in the wire going to the foot control, guys. Okay? Let's check our foot control function while we're down. First, we're going to check down. We're depressing the foot control with our hands, being careful to watch our environment, that we're not going to tear something up. Keep your eyes open. We're going to raise. We're listening for whines, hums, a high-pitched wing or a geek, 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 which would signify that the chair is low on oil or has a hydraulically aspirating air into the system in lieu of hydraulic fluid. And it sounds good. We're going to lower back down. Again, being aware of our environment. Good lower. Now, we're going to let the back down. Ladies and gentlemen, this is called a supine position. Don't tell the doctor, does it happen when the patient's in a down position? Doctor, be professional. Doctor, does this happen in a supine position? Now we're going to raise back up. We're listening for whining, the air noises I discovered earlier, I described to you earlier, and we're fine. We're also looking for stability and a lack of sponginess. It should feel like a definite surface with no sponginess or no resiliency in it. It should be right there, and it is. It should stay as stable as an anvil on a stump. Okay, we're good. Next, we're going to move on to the motor and the base cover. We're going to raise the chair back up, again being careful of our environment. Let me give you a helpful service hint here, which is my job. Release your swivel, guys. Make it easy on yourself. Again, being aware of your environment. Swivel the chair away from the motor cover. This gives us access to the motor cover without you having to contort yourself like an acrobat. All you do is simply remove the motor cover. Set the motor cover aside. Another word about safety, guys. If you don't feel comfortable with this unit plugged in while you're servicing it, unplug it. We're not servicing, we're maintaining. You can do either or. I recommend you unplug it. For ease and speed in the video, I am not going to power down. Okay. Our next indication is our circuit board. We're going to check our circuit board. You'll see 2 LED windows in it. You'll see an LED circling in sequence. Every one of these. Can you see that on the camera? We call that circling the wagons. If it's not circling the wagon when it's idle, when it's not being used, something's wrong. There's a short, potentiometer problem, or another indication that we're going to cover in a technical video. We're going to check our hydraulic level. We have a fill line, and it looks fine. I'm going to cover the lubrication procedure, the oiling procedure twice. I'm going to do it now, and also I am going to do it in the technical video. If you're going to add oil, make sure all your oil is firmly deposited and thoroughly deposited back in the reservoir, which means we're going to let the back down to exhaust all the fluid out of the cylinder. Throw the fluid that was in the back cylinder down into the reservoir. Now we're going to lower the chair all the way to throw, being aware of our environment again, guys, to throw every bit of the fluid back into the reservoir. So we get a true reservoir reading, not a false reservoir reading. We're going to take our flashlight, and this reservoir is perfectly topped off. You'll see gradients on the side of the reservoir. We have a fluid level about 1 segment of a finger down, which is wonderful, wonderful, wonderful. But briefly, let me go over the oiling procedure with you on this particular chair. Now, you've already got paper towels here. Whenever you're working around hydraulics, guys, rags, paper towels, okay? We're going to unscrew our reservoir lid. Very carefully, very, very, very carefully. Now, you see how I'm taking the fill spout out? Very carefully. When it flops out, it will sling oil all over the wall. You'll never get the oil off the wall. It'll rain the paint. So do it like I did. Grasp it with a paper towel and don't let it go and fling oil out. Set it aside with a paper towel on it, okay? Your oil goes in the top of the reservoir. This is for demonstration purposes only. We've oiled our reservoir. are going to set our fill tube back in the reservoir along with our retainer top. And we're going to tighten it securely and firmly. Next, we're going to inspect the chassis, the base, and the internal chassis on the base, as well as the solenoid manifold. We're going to use our senses, guys, which I call for you to do many times. God gave us feel, touch, smell, any number of things. Keep your hands clean. Use your paper towels to keep the slime off your hands. Actually run your hand over gently. See if you feel oil or see if you feel sliminess. Inspect every fitting for oil drops, and we have none. Inspect the chassis floor for oil drops or oil staining. We have none. Actually check your lines to make sure they're flexible, and they are. If your lines are hard, they need to be replaced. If they're brittle, they need to be replaced. We're going to cover that in the tech video, guys. Now, again, being aware of our environment before we do any function to this chair, we are going to raise the chair and put our hand on the hydraulic motor. The most temperature sensitive part of our hand, whether it be your palm or the back of your hand, okay? We're going to raise. Being aware of our environment, once again, we're going to raise and see if we feel any heat whatsoever out of the motor, and we don't. We didn't hear any whining, we didn't hear any clicking, and we didn't hear any clapping. Now, the most important part of the procedure after we add oil, raise the back up. We've already raised the base up. That has sucked the hydraulic fluid out of the reservoir into the cylinders. Now, we're going to put the back down, exhausting the oil out of the cylinder once again, but also exhausting the air out of the cylinder that leaked in while we had the reservoir open. This is a self-bleeding unit. Hydraulics must have the air bled out of the fluid to work efficiently and to work correctly. These are designed to self-bleed. You may hear a small belch or a burp from the system where air is blooping back into the oil. That's good. That's what you want to hear. I heard it when we kicked up to go up. Let's hear it, see if we hear it when we go down. And this will complete the bleeding procedure. Now we're going to rise back up on the back. And we're going to lower the base down. Again, being careful of your environment, guys. Back up one more time so we can access. Nice quiet operation, nice stable operation. One more time. Check our fittings for oil. Check our fittings for leakage. Check our manifold. And we are very good, guys. If you see anything, any areas of concern, power down and wipe. Again, leave it cleaner than you found it. The doctor will appreciate it. He'll keep retaining your services. Now we're going to put our motor cover back on. And that concludes the floor portion of it. Now, we're going to talk to the assistant and we're going to talk to the doctor. We're going to do a little schmoozing and we're going to do a little PR. And we're going to do our jobs. When you approach the doctor, you have a slight indentation on your headrest. Is that bothering you, sir? A slight upholstery flaw. Yes, it really looks unsightly. Well, good, doctor. Let's talk about a reupholstery job in what you would call Paul, and find out how much it would cost to get a package to reupholster this. If you use a package to reupholster from Superior, I'm sure we're all familiar with it. You eliminate downtime. You ensure that the doctor's operational when he wants to be, and you've sold an upholstery job. Now, let's do a little bit more PR. Doctor, Are your preset parameters okay for you, sir? Does the chair go as high as you like? Does the chair go as low as you like? Are there any particular problems, complaints, remarks, anything I can help you with on this chair while we're at it? Yeah, I'd like the chair to go a little higher. I'd like the chair to go a little lower. I'd like the back to go a little further up. I'd like the back to go a little further down. Okay, doctor. I'll call the call center, the operations support center, or have one of the ladies call you, and we're going to schedule a service call for that. It can be quite involved. We'll be happy to set and customize your switches and your automatic position to your leg length and also to your assistance length, to your assistance specs. Always show that you're willing to go the extra mile resultant from the maintenance. And follow up on the suggestions you make. Follow up on the upholstery suggestions. Follow up on mechanical suggestions. Follow up on your limit switch suggestions, where to set your limits. That's all another service call. Remember, try to write a service call up out of this. This is gateway in for upholstery sales and for out service call sales. As usual, if you have any questions, you may call Paul or myself or refer to the pertinent manufacturer. Have a good day and thank you for your attendance.